I'm Dr Ruth Collins. I'm a urological surgeon here at the Sound Hospital and I also work at Concord Hospital. So urinary incontinence, the simplest definition, is an involuntary loss of urine. So it's basically urine coming out when you don't want it to. The only time urine should normally come out is when we're comfortably sitting on the toilet. So if you have urine coming out at any other time, that's incontinence. And there's more than one type of incontinence. A lot of patients that come and see me think it's one problem, one fix, but it's a little bit more complex than that. So stress incontinence the definition is the same in men and women, and it's lack of support around the urethra from the pelvic floor. So in ladies, the commonest reason why that's a problem is because of the pressure that's put on the pelvic floor in pregnancy and childbirth. Because men aren't usually exposed to those pressures, the only time we tend to see stress incontinence in men is once the prostate is removed, and the commonest time we see that is after radical prostatectomy for prostate cancer. In the vast majority of cases, that resolves as part of the healing process after surgery. So you don't need to intervene at all for the first 12 months after radical prostatectomy, because most men who have a problem, it will resolve just with time and healing. And it's in fact only probably less than 5% of men that after 12 months have ongoing problems with incontinence. A proportion of those will have primarily bladder problems, overactive bladder, but there's a significant proportion that have stress incontinence, where there's lack of support from the pelvic floor to support the urethra. And typically they'll have incontinence with physical activity, lifting, coughing, sneezing, usually to the degree that they would need to wear a pad. And that's the group that I would then see. And the first line treatment's non-surgical, pelvic floor strengthening exercises, and only if they then don't resolve would you look at surgical treatment options. The main surgical procedure for stress incontinence in men after radical prostatectomy depends on the degree of incontinence. So for more minor levels of incontinence, it usually involves placing a supporting sling around the urethra. Whereas for overactive bladder, urge incontinence, if you have a patient that's not responded to non-surgical treatments, usually the next step is to inject bladder Botox. So injecting Botox directly into the muscle component of the bladder. And what that does is it actually helps relax the bladder, which intuitively, I think most people think relaxing muscles when you've got incontinence, that can't be the right thing, but we're relaxing the bladder, not the pelvic floor. So the bladder doesn't suddenly switch on and empty when you don't want it to, and that's how Botox works. In terms of dry rate, it's 85 to 90%, although Botox does wear off over time, so you may need to repeat that treatment. But again, across the board, the improvement in terms of quality of life with these treatment options is extremely high for procedures that really are minimally invasive, short procedures not requiring anything more than an overnight hospital stay at the most. And minimal complications post-operatively, and patients generally very satisfied with the outcomes.